For anybody who's not from the United States and you would like to know what health insurance is like here, let me tell you. Because I was just on the phone for 2 hours, not consecutively, but I was on the phone for 2 hours between my doctor and 2 health insurance companies. And I can't. Oh, my first starters, my health insurance is Horizon Blue Cross Blue Shield of New Jersey. I live in California, but I'm still under my mom's health insurance and she lives in New Jersey. So yes, my insurance is in New Jersey. I'm going through my emails this morning and I get an email from the billing department of my doctor's office and I see that I was charged $300, not once, but twice, amounting to $600 that I had to pay out of pocket. And I was like, oh, that's funny. That can't be true. So I call my doctor's office. It was in fact true. They tell me they submitted 2 claims for the service dates of December 11th, 2025 and January 7th, 2026. So I ask for the claim numbers. They provide the claim numbers. I call my health insurance again, which is in New Jersey. I hop on the phone with this very nice lady and she asks me for the dates of service. She asks me for the claim numbers, give her all the information, and guess what? She literally tells me, we don't see claims for either of the dates you've provided. Also, the claim numbers you've given us don't exist. Oh, really? So I'm like, okay, great. Let me call my doctor's office back. Call my doctor's office. I tell them I just got off the phone with Horizon Blue Cross Blue Shield of New Jersey. And they go, why did you call New Jersey? You should have called Horizon Blue Cross Blue Shield of California. And I was like, well, why would I call California if my insurance is in New Jersey? They then tell me because my insurance is out of state, they have to submit my claims through Horizon Blue Cross Blue Shield of California, which then gets sent to Horizon Blue Cross Blue Shield of New Jersey. My doctor tells me I have to call Horizon Blue Cross Blue Shield of California. I give them a call and I can't get through to any representative because in order to get through to a representative, you have to have a member ID number. And my member ID number is with Horizon Blue Cross Blue Shield of New Jersey and not Horizon Blue Cross Blue Shield of California. By the grace of God, after screaming at this fucking automated machine being like, representative, 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 I get connected to this lady. I start talking to her and do you want to know what she literally tells me within the first 5 minutes? I can't help you because you're not with this health insurance company. Oh, really? Really? I had no idea. Call my doctor's office again, tell them exactly what I was told, and they were like, that's odd. And I was like, yeah, I know. Let me call Horizon Blue Cross Blue Shield of New Jersey. Call my health insurance provider in New Jersey again. They proceed to tell me that my doctor should have never sent my health insurance through California because apparently the middleman, the California health insurance, was getting my member ID mixed up. So I don't know where any of these claims were going to, but it wasn't going to my health insurance provider. So I then had to call my doctor's office again and I had to be like, hey, diva, you cannot send my health insurance through California. You have to do it directly to New Jersey. And you want to know what she says? Oh, okay. Oh, okay. You could have done that the entire time. I will. Oh, 2 hours. I was on the phone for 2 hours in between my doctor's office, the California insurance, the New Jersey insurance, literally freaking out on the phone because I was charged $600. Mind you, the entire time, problem resolved in 2 seconds. All it took was my doctor's office sending my claim to the correct place. Mind you, I would just like to say this. I am under a very good health insurance plan. Like, my mom's been working in education for over 3 decades, so you know her health insurance slaps. So I can't even imagine what it is like for people who have shitty health insurance plans. Because if I had to deal with that today, I can't even imagine what other people have to go through on a regular fucking basis. Like, are you kidding me? Like, are you, oh my God.
Alright, so we are seeing the American healthcare. Right now, the MAGA voters are crying. They're saying they cannot afford healthcare. So what exactly happened? What went wrong? That is the question a lot of people are asking. So exactly why did they vote for that big, beautiful bill? Why did they vote the way they did? That's the question people are asking. So we're going to talk about this at the end, so kindly subscribe to my channel.
I can't live like this anymore. Nobody cares about you unless you're dead or dying.
When I was 21, I sustained a back injury that left me paralyzed with pain. The slightest movement would send excruciating pain down my back, through my buttocks, and all the way down to my leg. I wasn't able to put any weight on this leg. I literally had to be carried from my bed to the toilet, and I needed assistance in the toilet at the age of 21. And of course, like most Americans, I didn't have health insurance at the time, so I couldn't afford proper medical care. I went to the local family doctor and he did an x-ray and he's like, oh, well, you're young and healthy. This is probably just an inflamed muscle. You'll be all right in a few days. Fast forward 6 months, I'm still in this excruciating pain, unable to walk. My entire life shut down. I quit my job because I couldn't work. I dropped out of college because I couldn't attend classes, and I was isolated from all my friends because I literally couldn't go out. When we eventually realized that this was a serious medical condition that wasn't going to go away with rest, we collected money to pay for steroid injections to reduce the inflammation on my buttocks where I felt most of the pain. And these injections were $500 a piece, and I needed 3 injections. Now I can walk, but I'm limping because I still have pain. So we decide to do physical therapy. went to a physical therapist and found out that it was going to be $100 a session out of pocket. I was like, there's no fucking way I can afford this. She recommended me to go to a chiropractor, which was $25 a session. I was like, fine, we can afford this. I saw this man for an entire year. For an entire year, he kept doing these stretches on me, kept fixing my back, and every other week I would still be limping into his office. It took him a year to be like, hey, you know what? I can't fix you. You need to go see a surgeon. You need to see an orthopedic surgeon to find out what's going on. I think you might have a serious back condition. I go to an orthopedic surgeon. He tells me I need an MRI. I tell him, hey, I don't have insurance. How much is this going to cost me? He's like, oh, $1,200. I'm like, hey, I can't afford that. Can I go get an MRI from somewhere else? Can you write me a note? I'll go get an MRI and I'll bring it to you. He writes me a note. I pay $600 out of pocket to get an MRI. And finally, it's been 2 years at this point. 2 years after my injury, we finally find out that I have a herniated disc, which is putting pressure on my nerves. It's putting pressure on my spine, which is causing inflammation in my spine and causing inflammation through all the muscles throughout that nerve that runs down my right leg. So the surgeon tells me the only way to correct this problem is that I need to get a surgery done, which is called a microdiscectomy. Basically, they shave off a portion of the disc, which is putting pressure on my spinal cord. And this surgery costs close to $35,000 out of pocket. I tell him, hey, I don't have this money. What can I do? And he's like, well, you need to get insurance. And this is before Obamacare. So my only option was to get a job and work with excruciating back pain. And I'm like 23 at this time, almost 24. And the only jobs I can get without any work history or without a degree from a university is retail jobs. So I spent the next 6 months of my life standing, folding fucking clothes at Express and JCPenney so that I could get insurance, so that I could pay for my surgery. Whilst I'm waiting to collect the money to afford my surgery, my doctor is prescribing me powerful painkillers. I'm talking Vicodin, oxycodone, Valium to help with my pain. These are highly addictive medications. They're made from heroin, basically, the same poppy plant. He was prescribing them to me like candy. I would run out. He wouldn't ask another question. I would go in for my weekly or monthly visit. He would just write me another prescription. He's prescribing a child Vicodin. And of course, I got addicted. I got addicted to these pills. I found myself popping these pills in moments where I didn't have the pain. I just took it because I had the fucking craving for it like a cigarette. When I finally, first of all, become eligible for my health insurance, because it doesn't kick in right away, after months of working and collecting money, not spending money on anything else, just literally just saving money for my surgery, I gather the $6,000 surgery copay that I need to get this surgery done. I get my surgery scheduled and I go to my boss and I tell her, hey, I need a month off of work because I'm getting a major back surgery done. She tells me the best I can do is 7 days, which is 5 days that I normally am scheduled to work, plus the 2 additional days off the week that I get. So the best she can do is 1 week. And I shit you not, 1 week after my surgery, I'm working at JCPenney and I'm bleeding through my shirt because I'm not supposed to be on my feet. I'm bleeding through my shirt and my manager goes, hey, there's some blood on your shirt. Go take care of that. And by this time, I'm 24 years old and I get my surgery done. And through that, thankfully, I regained my mobility. But the pain has never gone away. I still, to this very day, I'm 36 years old. I have pain every single day. Every single day of my life for the past 15 years has been in pain. Fast forward 3 years, obviously I quit that job and I have a new job as a graphic designer for a much bigger company, and my injury is flaring up. I'm having trouble sitting at my desk, so I need to take some time off work. I wanted to apply for short-term disability. I went back to that surgeon, right? And I brought the form with me that my company was 100% okay with this. They're like, yeah, we can see you're hurting. Go get this form signed by your surgeon. I take this form to my surgeon and he looks at me and he's like, I don't believe you. I don't believe you're still having pain. We did the surgery. You should be completely fine. You're young. You're skinny. There's no way you're having this pain. And I was literally speechless. I was like, listen, my company has already approved this. All I need is for you to fill out this paperwork that says I have a serious medical condition. I don't need anything else from you. As soon as he gave me the paper with his signature, I stormed to the front office and I told them to give me every single medical record they have of me, and I never fucking want to see this doctor ever again in my life. I've spent half my fucking life in pain. You don't know what that does to a person. Like, I want to go out, I want to explore the fucking world. I want to see everything that there is to offer, and some days I wake up, I can't fucking walk. And why do I have to live my life like this? It's the worst feeling to try to explain to somebody how much pain you're in and they completely fucking dismiss you. 15 years, bro. You don't know what that's like. I was a child. I was a baby. My entire life has been ruined because I fucking had the misfortune of being in this fucking country that doesn't give a shit about its fucking citizens. Even as I'm sitting in my car right now talking to you guys, I'm in pain. And I've accepted I'm never going to wake up and jump out of bed and be totally okay and be ready to seize the day and be excited for what the day brings, because I'm always going to have this pain. If we had universal health care like most developed nations of this world, I would not have to live my life like this. From the moment I experienced the first sting of pain, I could have gone straight to the doctor and be like, hey, there's something wrong. We could have done the tests. We could have done all of the tests that I needed. If I had the proper care when I first sustained this injury, I would have never needed surgery. I would have gone straight into physical therapy. They would have helped me manage my pain, and I would never, ever be in this position. My entire life was ruined at the age of 21 because of the fucking healthcare system in this country, and my story is not unique. I'm not unique. This happens to millions of people every fucking day, every year, and our masters don't give a fuck. The healthcare system in this country is made for profit. It is not about caring about the health of the citizens. It's about squeezing every drop of money, that every dime that a person has.
This is what our shitty ass healthcare has come to, where my patients need medicine and supplies and their insurance won't cover it, and here I am spending my own money because my patient needs it, and he doesn't have any money and he can't work. And the insurance won't even cover what he needs. And I'm sad and I'm sick and tired of it.
You do not get free health care. You do not get free health care. Do you think that people who are 28 years old that can work and refuse to work should get free health care?
Congressman, a lot's been talked about Medicaid, healthcare, etc. A lot of countries in the world, Europe, Canada, they have healthcare for the people there. Outside, just now you said, you don't want to see a lazy 28-year-old get healthcare, whatever. My point is, every working and retired American should be entitled to healthcare. Would you sign on or write up a bill for Medicare for all? We've got Medicare now. We can start rolling back the age 5, 10 years at a time. Would you support that?
We can't afford that.
Yes, you can.
I'm also confronting one of the biggest ripoffs of our times, the crushing cost of health care caused by you. Since the passage of the Unaffordable Care Act, sometimes referred to as Obamacare, big insurance companies have gotten rich. It was meant for the insurance companies, not for the people. With our government giving them hundreds and hundreds of billions of dollars a year as their stock prices soared 1,000, 1,200, 1,400, and even 1,700%, like nothing else. That's why I introduced the great healthcare plan. I want to stop all payments to big insurance companies and instead give that money directly to the people so they can buy their own healthcare, which will be better healthcare at a much lower cost.
Hi, my name is Dr. Rubin, and we're going to set the record straight about those misleading or flat-out false statements regarding healthcare during the State of the Union address. And if you want to stay informed about evidence-based health with nuance and expertise, hit that follow button. The Affordable Care Act expanded access to health care for 40 million Americans, and it protected pre-existing conditions, meaning if you have any type of chronic disease like asthma, insurance companies could not jack up your premiums or make it unaffordable or not even accept you, which prior to the Affordable Care Act, many people could not afford health insurance if they had pre-existing conditions. And in order to keep the prices down, they had to put in place a rule that everybody had to get health insurance and pay into the system to help dilute the risk pool and lower premiums. However, President Trump during his first term eliminated the penalty for not paying into the system. Therefore, many people did not have to get health insurance, and it made it more expensive for everybody. And he removed cost-sharing reductions that the federal government were using to help lower the cost of health care. And now he's saying in his great health care plan that he's going to bring back cost-sharing reductions because, oops, that actually did help out lower costs of health care. So a lot of the problems related to rising healthcare costs stem from his first term, and he's blaming other people for the problems that he created. And now he has this whole campaign slogan where he wants to give you money to go buy your own insurance that will lower the costs of care, and that big health insurance companies won't get that money. It sounds great on the surface, but the reality is that by giving you as an individual that amount of money, especially if you have a chronic condition, is not going to give you the same level of negotiating power as having that subsidized for everybody from the government itself. Think of your Costco or Sam's Club membership where you pay a fee to get access to the bulk discount pricing. If companies like Sam's Club and Costco said, we're going to just give you that money back, but then you've got to negotiate on your behalf to get those discounts, you would never be able to get it. But at the end of the day, if you see your health insurance premiums rising, no one can gaslight you into thinking that it's not happening. This is what you can see in front of yourself, and you need to speak out about this because what's happening to our healthcare system is not good.
As an American, there are some things that you can truly never fully understand until you leave the United States. I moved out of the United States 2.5 years ago, and since then, there have been moments where certain things happen that completely and utterly break everything that I've ever known. And today, one of those things happened. I'm currently living in Germany, and very recently, I just got a part-time barista job. It's completely a part-time thing and just something for me to make some extra cash on the side. And I literally cannot even work more than 20 hours a week per my resident permit. And I haven't even started working yet, but there are some things about this job that have already broken me in a good way. As I'm in talks with the boss trying to get this job, I'm expecting like, okay, we'll do like an interview or something and they can see if they like me or not. And the boss emails me about like, they don't do like an interview, they do like a tryout day, and they're telling me like come in for the tryout day and see if you like it and if you fit in with the environment well. And when I went in for the tryout day and like all went really well and stuff, the boss asked me at the end, so like if you feel good about this job, like if you like it, if it suits you well and you think you might want to stay here, then just like write me an email and let me know by like Tuesday or whatever. And they're not saying anything about like whether they even like me or not. Like all the focus seems to be on whether like I like the job and I want to stay there. Like I ended up having to ask like, well, do you like me? Like my German isn't so good. So like, is it okay or is it like a problem? Like, how do you feel like I fit in with the environment? And only then did I hear from the boss like that, yeah, they liked me too. And then as we're going through the hiring process, like the first thing that they tell me is like, okay, the paperwork should be ready to sign in like 2 weeks. First things first, I need a little bit of information from you. And the first thing she asked me was, when do you want to take your vacation days this year? Literally the first thing that they asked me. Guess how many vacation days I get for a part-time 20-hour-a-week barista job? I am allotted 36 vacation days, or 6 weeks in a 6-day work week schedule. 6 weeks. But the thing that broke me today was an email from my boss telling me that not only is it possible for me to go on the public healthcare system, but it's literally required for me to. For context, this has never been possible for me before, and since I turned 25 and moved outside of the United States, I've only been able to have essentially travel insurance. And now through the German public healthcare system, I can pay into it and then see pretty much any doctor that I want to, as long as they have an available appointment for free or pretty much free. And the amount that you pay into it is like 100 euros a month. I haven't been to a dentist in like 10 years, and I know that partially that's definitely my fault, but I literally, through like the public health insurance, it's like required for you to go like twice a year. I was like kind of freaking out when I first got the email, and I was like texting my German friends so that they could like help me understand better, and because like I translated it, but I was like, I don't want this to be like a false translation or something and me get my hopes up for no reason. And they were like, congratulations, like, but I was like really overwhelmed by it, and they were like, I don't understand what the big deal is. Like, yeah, of course, anyone in Germany who makes more than like 600 euros a month, they automatically can go on the public health insurance. And they're asking me like, what, you didn't know that? And I'm like, no, I didn't know that. Of course I could have like researched that, but like the thing is when you're socialized like as an American, like why would I have even expected that or thought to research something like that? We don't even have a public healthcare system like this. And a 20-hour-a-week barista gig would never give you social safety nets from it. Like, why would I have expected that? People who are not American will never understand that Americans systemically is so harsh and unforgiving and just cruel that it socializes you. If you're poor, if you're not wealthy, then it socializes you into having just an overall pessimistic mindset or having expectations that everything will be so difficult and or impossible that you should set your standards super, super, super low, like in hell, so that you can be easier to exploit. Why would I have ever thought to look something like that up? I'm used to a part-time job giving you nothing. I'm used to public healthcare not even really existing. I'm used to literally everyone I love around me being like constantly in this state of like nervous system dysregulation because they're constantly in fear that if they have 2-3 bad months, then they're literally on the street. I'm used to seeing women in abusive situations not be able to leave their husband because they will lose their healthcare or it will be too financially crippling for them and they are terrified of being homeless. I'm used to people working 2 to 3 jobs and still being so scared of not being able to make ends meet for their family. I'm used to things being impossibly expensive. I'm used to things being intentionally made to be as difficult as possible to deter people from obtaining them. I'm used to things being unforgiving and uncaring and unhuman. Like, I can't believe how easy it was for me to obtain the essential care that every human being needs and deserves just by serving a little bit of coffee. Like, of course you can read and research about other countries like as much as possible, but there's some things that you don't fully understand until you leave the United States. I'm so angry and full of grief that our government and our society and media and whoever else has convinced us that the way that we live is normal. I'm currently writing a Substack article talking about all of the various things that I've learned that you can't really understand until you leave the United States. And so you guys can follow me there if you are interested in more information like in this video.
This next message goes out to the American healthcare system. The prices are fucking astronomical. We need a rework of the whole goddamn system. It's like you pay every month for the insurance, you pay when you get to the doctor, and then you pay for whatever insurance don't feel like paying. It's getting so bad, God forbid, I might need like a surgery or something, like a leg amputation. I get halfway through the surgery and start thinking about the price. I might be like, you know what, just put the leg back on. Just put it back on. A few years ago, I went to an urgent care for a little bit of pain. I walked out that building with a $2,000 bill and a prescription for some Tylenol. I could have just went to CVS. Like, sometimes I don't even want to go to the hospital because I know it might cost me an arm and a leg, literally and figuratively. When I go to the hospital, I be scared of the bill more than I am the diagnosis. What kind of shit is that? Like, I ain't got all the answers, but we need to find something real goddamn soon. Sincerely, an upset patient.
This is what happens if you don't pay your medical bills in America. You basically have 30 days to pay your medical bills, and they will call you and basically harass you every single day to pay your bill. After it's been 60 to 90 days, they will sell your medical bill to a collections agency where your medical bill will start gaining interest. And from there, they will also start harassing and calling you and basically telling you to pay your bill. Depending on how impatient your collections agency is, they can take you to court and sue you, and they can go after your wages, your paychecks, your car, your home, until that medical bill is paid off. It also really depends on the amount too. Like, I don't think they're gonna take someone to court for a $100 bill. I know that your medical bills can't affect your credit score, but once they do sell it to a collections agency, that's when it can. However, a lot of people actually don't know this, but you can actually negotiate your bill and by a lot, like half the cost, because at the end of the day, all they want is your money. Yes, you can also do this with your collections agency too. You can also do monthly payments too, and as long as you're making monthly payments on your bill, they can't come after you. So you can literally pay $1 a month and they can't come after you. Usually if you don't have insurance, there's usually charities that will help cover your costs. Even the hospital themselves will give you a discount if you don't have insurance. I know there's a lot of people that will say that their medical bill disappeared without paying for it. That's because either the collection agency gave up the cost of it, like you probably just owed like $100 and they're like, it's whatever. Or because they're gonna come after you years later once your bill has gained a lot of interest. So yeah, that's basically what happens if you don't pay your medical bills in America, unfortunately.
Dear Republican lawmakers, I'm an unemployed young person living in my mom's basement, and you just voted to take away my Medicaid. And you said that I needed to get a job because I'm a lazy bum. Well, here's how I became the lazy bum I am today. A year ago, I was employed, therefore I deserved health care. I was building buildings for our great nation. I was presenting research at conferences. But uh-oh, I got COVID, which developed into multiple chronic illnesses, which made me really lazy. Here's me lazily getting tested for my debilitating chronic fatigue. Here's me getting infusions because COVID destroyed my immune system because I'm so lazy. I was taking all these pills trying to maintain my job, but I was just getting sicker and sicker. Or, lazier and lazier, am I right? I got so sick that I needed to quit my job, leave the life that I had built, and move in with my mom, and it was all because I was just so lazy. I quickly blew through all my savings to maintain my health care. And because we're so far from a cure from long COVID, and let's be honest, who wants to fund that anyway? I had to get on Medicaid to maintain my health and keep myself alive. But now you've introduced work requirements to Medicaid to cure me of my laziness. I have the privilege of neglecting my health until it becomes a medical emergency and then showing up to the ER and then after that declaring medical bankruptcy. What freedoms? You'll probably tell me that this can all be avoided if I apply for disability, but we both know that that will take years to approve, if at all. So thank you, Republicans, for selling out my health for Jeff Bezos' next yacht, just as God intended. I'm proud to be an American.
I'm 36 years old and I'm about $3 million in medical debt. After a heart attack, open heart surgery, and life support, I was 8 weeks in the hospital. I'm a retired veteran or medically disabled veteran, and you would think they would cover it. I showed a video like this when I first got to the hospital back in November, and I showed this bill right here, totaling $500,000. And everyone said, it's not $500,000. You only owe $22,000. Your insurance paid the rest. Yes, you're correct. But what about these other hundreds of bills that I haven't even opened some of? Let me give you an example. This one says amount $1,400. Veteran responsibility. The VA only covered $400. I owe $12. Let's get another one. $1,200. $22,000. Veteran responsibility $500. VA only approved $134. I owe $424. Veteran responsibility, $2,080. The VA only approved $432. I owe $1,647. I could keep going with this. I have hundreds of bills that I haven't opened. I don't know when I'm going to get around to it. It gives me anxiety. Yes, I'm still on hundreds of medications that I need to survive. Good news is, I just got pulled off of dialysis. I no longer need dialysis. Well, I surgically have this placed into my chest, this device, as you can see here, and it needs to be removed surgically, anesthesia. Guess what? The hospital that put it in called me yesterday and told me the VA denied it. The VA did not give them the green light to remove it. So I'm stuck with this fucking catheter in my jugular vein through my chest, and the VA won't approve of removal. You wonder why people are pissed off at the American health system. I have millions of dollars in debt after just surviving surgery, open heart, life support, medications for years to come, and they can't approve a fucking catheter removal? This is bullshit. America, get your fucking shit together.
So I just saw a video of a black woman who walked into a traditional Chinese medicine hospital in Guangzhou. She wasn't in crisis. She wasn't bleeding out. She just wanted some herbs. She told the doctor her symptoms. And instead of sending her home with a little paper bag, they admit her, like, right there. No ER wait, no insurance interrogation, no proving that she's sick enough to deserve care. They give her a spotless bed, a balcony for fresh air, daily tests, both herbal and Western medicine. And they do it all without hesitation. Because the goal is simple: treat the problem and the person before it becomes an emergency. Meanwhile, back here in America, the same exact black woman could walk into a hospital and be told to go home the same day. Because here, healthcare wasn't built to save everybody. For most of the 20th century, hospitals were legally segregated under Jim Crow. Black hospitals starved of funding, staff, and equipment. White hospitals got the latest machines, the best specialists, and the lion's share of federal money. Even after the Civil Rights Act, some Southern hospitals shut down completely instead of just integrating. Others found loopholes to keep us out. Then they tied healthcare to employment, knowing damn well that black people were locked out of industries and union jobs with real benefits. That wasn't oversight, that was engineering. And it worked. Today, black women are 3 times more likely to die during childbirth. Black patients are less likely to be given pain medication, even with the same symptoms as white patients. Whole black neighborhoods are medicine deserts with no urgent care and no specialists. This isn't a system that needs improvement. It's a system that's functioning exactly how it was designed, to ration care based on who they think is worth saving. So when I watch this black woman get admitted in China without a fight, I'm not thinking, wow, they're advanced. I'm thinking, what the hell is wrong with this country? Because in America, she'd be waiting for hours, arguing with insurance and praying the doctor actually listens. And if she died while waiting, we'd call it tragic instead of calling it what it was. The point.
Alright, so the big beautiful bill was passed, and now we are being told in the rural areas of America, some hospitals have closed down. Why? Because they don't have funding. They remember the big beautiful bill that was passed the other day? Yes. So that budget cut, so rural hospitals are being shut down because they don't have enough funding to run them. They don't have enough workers to run them. Why? Because of the big beautiful bill, the budget cuts. So now rural people are forced to go to travel miles and miles away just to access healthcare, to access hospitals. Who is to be blamed? That's the question they ask. That's what people are asking. But the question is, you voted the way you did. Why did you do that? What were you expecting? These are the results. This is what they call karma. And you're being told right now, a lot of Americans especially, they are being forced to go into their personal pockets in order to afford healthcare. You're being told, because of the big beautiful bill, the budget cuts that were done, Affordable Care Act, right now, some services are not being covered by the Affordable Care Act. So families are forced to go through their pocket in order to afford healthcare. And it's expensive. So some even they're not able to afford it. Some are saying, you know what, I cannot afford to pay these medicines because it's expensive. Why? Because people, they voted the way they did because of the big beautiful bill, the budget cuts. So who is to be blamed? We are being told right now, as we speak, some people literally are deciding to live with pain. Yes, because they cannot afford to pay the medicine, the pain medicine. They cannot afford it because it's not being catered for under the Affordable Care Act, which they're paying for. So people literally are forced, you know what, I feel pain, I know I'm supposed to go to the hospital, but some people are deciding not to go to the hospital so that they don't have bills which they cannot afford under the health care. That is how people are surviving in America. If you look in this video, social media platform, you are seeing people talking about it. You are being told people are running away from ambulances. Yes, they're hurt, but they're not agreeing to be taken by ambulance because they cannot afford to be rushed to the hospital using the ambulance because it's expensive. You're being told using an ambulance is over $10,000. Yes, for an ambulance to take you from one place to the hospital, it's over $10,000. And some Americans cannot afford that because it's expensive. You are seeing situations where people are running away from ambulances. They're like, no, I'm okay, I'm fine. And you can see this person is bleeding left, right, and center, but they're not taking the ambulance because they cannot afford the bill. That is how Americans are viewing the healthcare. It's crazy, yes. For somebody who's on the outside looking in, because I am from Kenya, and yes, I am looking at the American system, the healthcare system, and I'm like wondering, wow, I'm lost for words. I'm speechless because for people to run away, they're in pain, they're bleeding, but they don't want to take an ambulance. That says something. That is something which I cannot fathom. I cannot even, in my head, I cannot even, it doesn't make sense. But the reality is, it is what's happening in America. For somebody who's going through pain, and they've literally gone through, hospital, and they're being told, what, this is the bill, and they're like, oh, okay, I'd rather not go to the hospital. I'd rather live with the pain because I cannot afford the bill. I cannot afford the medicine because it's expensive. That is healthcare in America. That should tell you something. It's painful, it's shocking, but yeah, this is what people voted for. So you're being told in America, the rich become rich while the poor become poor as a result of the policies which are being put in place. For the healthcare, you're being told the healthcare favor more the rich and it less favors the poor. And the people who are going to suffer are the people in the lower class, that is the poor in the American system. So tell me, what exactly is happening in America? Why is healthcare so expensive? Who is to be blamed? Exactly. So let me know what your thoughts are. I'd love to hear from you guys, and kindly subscribe to my channel.